Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Radiotherapy. So under radiotherapy, first let's learn about the teletherapy. Teletherapy, the radiation source is placed at a distance away. So it is at a distance away from the patient's body. Next is the external beam radiotherapy. That is the EBRT, that is the external beam radiotherapy. Then comes the brachytherapy. Brachytherapy means the radiation source is placed at a short distance away from the patient's body. Brachy is a short distance from the patient's body, that is, it can be near or inside. So when the source of the source is inside the body, we can use. So when the source PBC is inside the body, we can use the seed brachytherapy, as well as the systemic brachytherapy. Now let's look at the systemic brachytherapy. The systemic brachytherapy, there is a diffuse cancer. So it is a diffuse cancer. Examples of systemic brachytherapy is the radioisotopes, including the iodine 131, the phosphorus 32, as well as the strontium. Systemic brachytherapy radioisotopes, they generally emit the beta rays. And the pure beta emitters, it includes the phosphorus P32 as well as the strontium. So iodine 131 is not a pure beta emitter. The seed brachytherapy is accessible site and the implant may be temporary. So implant is temporary as well as it can be permanent as well. The short half-life of the implants are used permanently, that is the cesium 131, the iodine 125, as well as the radon 222 and the palladium. So what is the long half implants? The long half implants used temporarily, it includes the iridium as well as the cesium and the cesium 137 and the cobalt. So the stereotactic radiotherapy. So what is the stereotactic radiotherapy? There is use of the gamma knife and inaccessible small brain lesions, as well as the stereotactic body therapy utilizing the LINAC, LINAC. So LINAC is the EBRT. It involves the use of the cobalt machines. So cobalt machines are used. Then, so EBRT, it involves the use of cobalt machines or the LINAC. The linear accelerator LINAC produces the electrons and the X-rays. Next is the most common use is the modern. There is a modern radiotherapy, the most commonly used. Now let's look at the gamma knife. So in case of the gamma knife, it is a Lexel. There is a Lexel frame used in case of gamma knife. The gamma knife is a form of a stereotactic radiosurgery. It is a stereotactic radiosurgery. It is invented by the Lars Lexel. This is the person who was involved with this Lexel. It is used for brain lesions such as the trigeminal neuralgia. Trigeminal neuralgia, as well as the pituitary adenoma, as well as the meningioma, AV malformations. It is not used in the TB of the brain. Now let's look at the frame. A frame with the XYZ coordinates. It's placed in the patient's head. There is an MRI. It is used in case of the tumor localization. Next comes the multiple beams of X-rays. It is focused on the tumor site. Now let's move on to the cyber knife. So what is the cyber knife? Cyber knife, it uses the X-rays. So X-rays are used and it is produced by the LINAC. So the advantages is, what is the advantage? Advantage is it is frameless. It is used for the rest of the body. And it is used for the treatment of the localized early cancers. To learn and grow daily like this, please do subscribe.